On some level, we all know that health extends beyond the physical, and to feel well, we need more than pills and a diagnosis. Industrialized medicine is often unable to reach the roots beneath disease and empower us to create our own sense of health and well being.
This is Dr. Dumbass and the Wounded Healer. My name's Ashley Palmer.
And I'm Samuel Simonson.
The system is useful for some things, but frankly, it is overrun with bullshit. The intention of this podcast is to explore other ways to approach life, health, and society at a time when change is inevitable and everywhere.
We may be dreamers,
but the status quo sounds like a status no, man.
Serious disclaimer ahead.
We're not against conventional medicine, and we recognize its value.
Being open to holding different perspectives and allowing for individual truth is essential to recognizing the humanity in each other, regardless of our identities or ideologies.
So we're swimming in murky waters here, but we believe that discussing gray areas can help open space for change. Our intention is to be empowering and thought-provoking.
Enjoy the conversation. Okay, so what was, or we want to start with? With delusionment.
Disillusionment.
Disillusionment. There
or
we go.
Or disillusion?
Delusion? Something.
So, disillusion. What does it mean?
Well, I looked up the definition just now, and it said to be disappointed or like to come to the realization that something isn't as good as you thought it was.
Were you disillusioned with Western medicine?
Absolutely.
Yeah, me too.
Broke my heart.
Yeah. Yeah.
It's an interesting, so disillusion, because then what I was thinking about with it is disbelief in the illusion, or you don't believe in the illusion.
You realize that it was an illusion.
An illusion, yeah. So then it's like, what is the illusion?
Yeah.
And the illusion, I think, is what the stories we attach to it, like the stories that like society and the people and the practitioners and all these things based on their experiences in life and what they've gone through attach onto this biomedical conventional medical model that we have. That would be the illusion.
What kind of stories are people telling?
Because I've been thinking about this, or I was thinking about this on the drive over here, is conventional medicine, or like a biomedical model, is trying to attach a story to symptoms through diagnosing them and tie that back into the body very specifically. Like, okay, we have this lab test, we have this thing that proves this is the case.
Yeah, so, but this is wrong with this organ.
Yeah. So it's like quite a technical process, and it's not something to be believed in or not believed in. It's just like a tool, like a thing that is happening.
Yeah.
And I think, so for me, I think the stories, or I was telling myself all kinds of stories before going into medicine that, maybe this was the avenue to really heal people or really help people, or see health as more than physical. And then realizing that, it's just a tool. I got trained in how to use a tool.
Yeah. And so I guess part of the illusion is that this is the best way for our society to be approaching health and disease and treatment.
And that illusion is based on essentially like colonization. Or that belief that we're separate from the body.
Because it requires separation. And it requires, this is something else, like to practice, or that I experienced, to practice conventional medicine, I felt like I needed to separate myself from my body, and also at times, a lot of times, separate myself from the person in front of me, because otherwise it's just it's impossible.
Well, I had started painting a picture in clerkship, and I still haven't actually finished it, but what it was this like silhouette of a person, and their head was kind of disconnected from their body, and then their heart was like removed from their body, like in front of them, and there was this gaping hole in their chest. And it was like, I remember when I first started painting it, I remember being like, I'm gonna title you Medicine. And then that's what clerkship did to me.
Yeah. Yeah. Because it's like, and it's not that like, because what I hear a lot when I hear people talking about how medicine would be so hard, they're like, oh, it would be so hard to be giving people bad news, to be giving people news that like they've got this terrible disease or that they're
Mm-hmm.
gonna die or whatever. But like that to me wasn't, that's obviously, painful whenever you're telling somebody like really difficult situations, but
Mm-hmm.
it's so much more than that that's hard.
Yeah.
Like that's not the thing. When I think about why medicine is hard, that's not where I go to.
No, no, I don't go there either. That's part of what makes it a bit more fulfilling, is being
Yeah,
able to
to
give
be there for
people.
people in those
Yeah.
really hard moments, that's one of the better parts of the job. Even though it's really painful, it feels like you're actually able to do something with your humanity and
Mm-hmm.
be there for somebody.
Yeah, yeah, no, it's not that. It's the, I guess, like, because medicine is like a reflection of society or whatever's going on around it, and we have this view that's overly tied into a biomedical model.
Mm-hmm.
Everything is a reflection of that. So it's like overemphasized. And I guess what I'm thinking with this is, like, I remember one of my first cases in clerkship on like my surgery rotation. Um, I had a patient who, I went and saw her. She had some right upper quadrant pain, whatever, had been admitted to the hospital. And no one knew what to do with her. Her blood tests were normal. They had done some imaging. She didn't really.
It's not picking up all
Oh,
the time.
okay. I'm turning away too much. Um, and she had not. She'd had some imaging. I think it was an ultrasound or a CT, or she had something. And it didn't really show any issue with her gallbladder. And I remember I went and talked to her, and I spent a long time with her, which, number one, you don't do on a surgical rotation.
Yeah, they're
And
quick
yeah,
because
and
you've
I
got so much to
learned
do.
so much about what was going on in her life surrounding this pain.
Mm-hmm.
Like, she had had this pain before. It wasn't new. It wasn't preceded by like dietary things or anything. What it was preceded by is her partner's mental instability. So they would become psychotic. And usually, when they were admitted to the hospital, she would develop this pain and end up in the hospital too. And no one would ever be able to find the answer. And this had happened like 3 times. So
Mm.
I go to the surgeon and I said, I presented that story, and they first had no time for like the social factors or whatever, and they just wanted to know if there's something to cut,
Yeah,
which is fair.
that's their job.
That's their job. And I said, no, there is not. And that patient still ended up with a cholecystectomy, still ended
Taking
up,
out our gallbladder.
yeah,
Yep.
getting her gallbladder out. And that moment, what it did to me was it made me realize how misdirected the physical tools that we use in medicine can be.
They can be severe.
Yeah. And that harm is, that all you have is a desperate person in pain.
Mm-hmm.
And if that desperate person in pain had had a completely different approach to them, like, maybe going through some type of somatic therapy, going through something, like they weren't in a hospital where the tools around them were, surgery and medications,
Mm-hmm.
um, they probably would have ended up in a very different place. And there would have been a lot more healing happening in that interaction
Mm-hmm.
versus a surgery that may have outcomes like post surgical pain, or I don't know what happened to that woman in the end, but
Yeah.
like, that's the shit that burns people out.
Yeah. And then also, like, so you take out the gallbladder, okay. then maybe you won't be having problems with your gallbladder. But if you're still having these life situations that are really, you know, harmful to you, something else is going to go wrong. It's not like you're necessarily fixed if you're still not getting to the root.
No, and I think like what happen would have happened in that case is like, this had happened multiple times. I mean, I don't really think she was getting gallbladder attacks each of those times. We didn't have evidence on blood work or imaging. Like, we didn't have strong evidence. And I just remember the word microcalculi being thrown around a lot. And I know that that can happen. That's not a unheard of thing.
Mm-hmm.
And then, her being booked for surgery. And I just remember being flabbergasted that the all of the pieces that would lead to that diagnosis, um they weren't there.
Yeah, it doesn't always fit.
And it just was like steamrolled straight to the point, or to the treatment, before spending time going, do we really have this diagnosis? And that blew my mind then, and still blows my mind now. Less so, but it's
Yeah.
just like, how did we how did we end up in that kind of place? Like, just people, like, when I say we, it's just like,
Yeah.
that's not health.
Yeah. Well, yeah, and like some of it is like people wanting to help, but just because you want to help doesn't mean what you're going to be doing is helpful. And then also, yeah, people are just burnt out. Like you could hear that story and like think that that surgeon or the whoever is making these decisions are like, I don't know, bad people or
Oh,
something,
they're
but they're
not
not.
bad people.
They're
No,
not.
they're awesome people. It's
Yeah.
just, when you're
These are the
trained.
situations that people find themselves in.
Well, and that's kind of like when you're trained in a certain tool. If all you have is a hammer, is everything's a nail. That
Yeah,
kind of
yeah.
thing. It's just
Exactly.
like when you're trained a certain way, and then that influence of being trained in that way is coming from society itself.
Mhm.
So it's like, what people are actually looking for.
Mhm.
Well, people are looking for all kinds of things. Um, I think a lot of times when people come to the doctor, they're probably looking for a listening ear and some reassurance that it's not a
And
physical problem.
yeah.
Like, they don't need to be that concerned about it, and
Mhm.
they can look in other places.
Mhm.
Um,
It's so interesting with surgery too because like standardly surgical residencies are the most intense. Like you have to work for days essentially with like no sleep sometimes because when you work as a surgeon you get into situation because there always has to be a surgeon on call no matter how many surgeons you have staffed. So then someone's on holidays, whatever, surgeons just get in these situations where they're working so much. And so when you're working so much and you don't have enough time to take care of yourself or sleep or eat, and then you need to be making decisions about whether to cut somebody open or not, like it's just it's quite a wild situation that like one of the most invasive, well, the most invasive thing that we do to each other, which is surgery.
mhm,
Like those people who are doing the surgery get put through just such hell, and like it just it doesn't make sense. You
mhm.
would think that if people are needing surgery, you would think that if people are needing to be cut open, you would want those people to be rested and to be taken care, be have the ability to be able to take care of themselves. It's just not responsible to be putting healthcare workers through such, like, just not having their needs met.
Well, it's that kind of thing of like, when, I mean, you can't pour from an empty cup. You
Mm-hmm.
can't do these kinds of things. So it's like, and what I mean by that even more is like, you don't have your mind, your body, yourself. You don't always have time to really come to see the full picture.
Mm-hmm.
When things are that way, and just like in the clinic, being, in another setting, or and being trained in that biomedical model, there isn't always time to see the full reality of what's happening with
Mm-hmm.
someone. And like, the the story a diagnosis tells about someone's health is quite limited.
Mm-hmm.
It doesn't explore the rest of it. And I know we're taught to, explore in the clinic, but then we're sent into places where you have 15-minute appointments and or 10-minute appointments or whatever you have, and you've got a whole bunch of people booked, and it's like, well, you don't really have time to explore
Yeah.
people's lives. And that would give a lot more information about their life. It's not that, like, and I guess then the biomedical tools could be applied more with more discernment
Mm-hmm.
into people's lives.
Mm-hmm.
Because when that it becomes the catch-all almost, like, everything, like there must be something going on with this person, and instead of taking the time and the space to like somatically experience something with someone, or really work through things, it's just a reactive blood work, differential diagnosis, um, prove it's not all of these things. And it's just like
What can kill you and what's common?
it feels like the wrong place to be. It's not the wrong place. That's, I don't want to put right or wrong language to it because that's not accurate. um it feels like we need more tools
Yeah. Yep.
at the very least.
Yeah, at the very least. Is it's like one tool and then just when you're so stretched for time, like you're gonna fall back on what is ingrained in your mind, which is the biomedical
Hmm.
model.
Well, and that's what you're needed. That's your job.
Yes.
Like we're trained biomedical technicians. Like, order the blood work, follow these algorithms, apply these differential diagnoses, and maybe come up with a diagnosis and then a treatment. Like, that's a very like factual kind of work. Like, you can find the blood works off and then you can say, I don't know why, but I can give you this pill to remedy it.
Mm-hmm.
And it's just so,
Yeah.
like, it's powerful, it can do what it needs to do, but it's moving things around without getting down into the root.
Yeah.
And because the roots always go multiple places, and because we're more than just a physical being, like we're our social environments, we're our inherited environments, we're all of these different things
Mm-hmm.
at once. Like, we're more than medicine gives humans credit for, I guess.
Yeah. I think all healthcare workers are all I don't know if I've ever worked with a doctor who on some level wasn't disillusioned throughout the
Mhm.
process, which is really interesting.
Well, one could say that life is just
Yeah.
disillusionment.
Yeah.
But I guess the thing that's interesting to me about illusion, like, illusion isn't truth. Illusion is what someone thinks or whatever.
Mm-hmm.
Um, so disillusionment is kind of, it's a disappointing process, I guess.
Yeah.
Um, and it can really burn someone out or disempower someone, but it is revealing a truth. And so then I think that truth is then the place to work from versus the feeling of disappointment.
Oh, definitely.
Yeah. So it's just interesting, like, thinking about what the root of the word, I guess, like
Yeah.
what it actually says about something. And it says that there's a disappointing truth, or like,
Yeah.
you know.
Yeah. Interesting.
Hmm. So I guess for me, in like a naive mind, when I went into it, I hadn't understood these things, so it was just, you know
Mm-hmm.
thought it was all good.
Yeah.
Not that I thought it was all good. I mean, it was an intellectual process, understanding the bad parts. It wasn't physical. Like, I've
Mm-hmm.
felt the emotions associated with this. I've understood this.
Mm-hmm.
It was just an intellectual thing.
Yeah. We had a question about empowerment or disempowering ment with in healthcare.
Hmm.
What
Um,
did it say? What was it?
how does medicine take away someone's power?
Yeah. It takes away doctors and patients' power. Well, everyone's power. I won't list all the healthcare jobs, but it disempowers everybody.
Yeah, and I'm just thinking about like how does it I don't know, how does it do that? Like what comes up for you?
Well, it's a system. It's a very rigid system, and just working. It's like kind of like working in a bank. Or when I've been dealing with the bank recently, and the way that the bank people will talk to me and the way that they'll act, it reminds me of healthcare. Like
Mm,
I can see what they're doing. I can
it's
see what they're.
transactional.
It's transactional, and it's trying to just. There's so much deflection. Like it's a lot of deflection.
Yeah.
Like you just don't want to be a. Like as a doctor practicing, you don't want to miss something that's going to kill somebody.
Hmm.
And so you're just always thinking about that or whatever. And like it's not about necessarily helping people be fully healthy and well, because you don't have the time for that and you don't have the tools for that.
Exactly.
And so what do you want to do? You want to make sure you don't miss something that's going to kill them.
Yeah.
That's what you want to do. And so that's not necessarily empowering. That's you're just trying to not to not fuck up, essentially,
Y-
is what I felt a lot of the time. Everyone's just kind of trying to not fuck up and do what they're supposed to and whatever, 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 like a bank.
Yeah,
But we're
like
dealing with
be
humans.
be that transactional biomedical technician.
Yeah.
Like and the reason I keep saying that is because that's not like that job, like being trained in that job, that's not about like the heart or the human or like
Mhm.
genuinely connecting with someone. You can try to layer that stuff in,
Mhm.
but the system doesn't really set you up for it.
No.
Um and so I guess like back to illusion, like one of the illusions is that you actually are going to get that kind of human centered support
Yeah.
when you go see a doctor.
Yeah.
And maybe that shouldn't be the expectation. Like the
Cuz
expectation should be that you're going to get a biomedical approach, like biomedical tools. And to say it's more than that would you would have to really shift how the practice is done.
yeah.
Like because you can of course counsel and you can say I don't think this is a physical problem,
Mhm.
I think you need to look in other areas, you can refer to a counselor, you can do these kinds of things. um but I don't know.
This kind of thing used to make me so mad because I had my own experiences in healthcare and knew people who had terrible experiences in healthcare, and so it made me mad. I was like, oh, like this should be better. Doctors should be more like this. Healthcare workers should be more like this. Like like heart centered and whatever.
Hmm.
And then I went through the process of becoming a doctor, and I was like, oh, I get it. I get why it's impossible. So like getting to this point, if things are going to shift, can't be done through anger. Like it's fully like makes sense to be mad, and like people have there's so much healthcare trauma out there, but like moving forward as humanity, like things don't change through pointing fingers and screaming. Like
No.
it can't. It's like it's addressing the rotten roots.
Yeah.
And yeah, it's like yeah, it's a big topic.
Yeah, no, it's like it's a hard topic. It makes me feel like the way I feel it in me is like a pit inside me that just feels kind of nauseous and a little bit sick.
Yeah, yeah, it is nauseating. It is nauseating.
It's just like, whoa, like, there's so many places to go
Hmm.
from that, from these concepts, I guess.
Yeah. And I've been so mad about it at different points. Like anger is something you have to work through if it's there, obviously.
Well, and I guess that's like getting back to burnout. Well, it's an interesting thing because I've been asked by doctors who really like, are passionate and are believe in what they're doing. Um, what I'm, what makes me so mad that I can like stay mad about it long enough to do something about it, like stick with
Yeah.
it that way. And I'm just like, I remember just being like, I, I don't know how to answer that because like I'm at a place where I'm working on my anger reaction to injustice
Yeah.
as like not being the most productive thing. Like it can be motivating, but it like can move a whole lot of energy in the wrong direction,
Yeah.
or a non-productive direction, just like a yelling about something
Mhm.
or pointing fingers or whatever, like you said. um so it's like I don't know if that's what it means to not get burned out, is to stay mad about something long enough. Like I don't know if that works for me.
No. No. Yeah, that sounds like a recipe for heart disease.
Yeah, yeah, I just remember being like, this doesn't seem like the right environment for me.
Mhm.
Because to me passion is not anger.
No, it can be love. Like,
uh,
yeah.
and not that anger is not a bad,
No,
or
anger is essential.
we talked about that,
Yeah.
but it's just like I don't need to be
Mad all the time.
excessively angry all the time because of someone else's experience
Yeah.
or the hurt I see.
Yeah. That's like the energy that seems to be typically used or maybe needed. I don't know. But like dealing with like politics and like, I don't know, moving things forward in that way. I don't know. They're always yelling.
Yeah, that's, I mean, but politics,
I'm talking about
medicine,
the politicians are always yelling.
medicine is but politics, whatever Virchow
They're,
said that at one point in time.
uh,
um
yeah, they're definitely
and
related.
so like if you look at the two things, it's like no wonder we have what we have as a medical system.
Yeah. Yeah. Like, yeah, we need to step outside of these yelling politics. And yeah, that's incoherent, but
uh,
it kind of scrambles my brain.
Oh,
Like just thinking about the political
yeah.
system just kind of scrambles my brain.
So then what comes out is scrambled then.
Yeah.
That makes sense.
Yeah.
And I think it's often incoherent what we're hearing from politicians as well.
Yes. Yeah. Yeah. It's quite incoherent.
Yeah.
It's so limiting. God damn it.
Yeah. It's something. It's like that. I don't know. Just coming back to burnout, I think. Is this a physical process?
Burnout, it definitely has physical implications.
And it must be reflected in our physiology on some level.
Yeah. Must be.
And so it just seems like living through these cycles of burnout consistently.
Mm-hmm.
Like, what does that do to the body over time?
Wears it down. Definitely age faster. People in medicine, like
Yeah.
people who are trained in medicine, they age faster than their peers.
Yeah, there's shorter telomeres.
Mm-hmm. Which is not surprising because it's so stressful.
No, and medicine has like high suicide rates and early mortality and
Mm-hmm.
all these kinds of things.
Yeah. It's not right. Something's off.
Yeah. Well, oh, I thought this when we were talking about, that kind of righteous anger, like at injustice.
Mm-hmm.
Um that I wonder if that
Idiot compassion.
I wonder if it blends in with saviorism.
Oh yeah, definitely.
Yeah.
Idiot compassion.
Yeah. What's idiot compassion?
Saviorism. Well, it's like when you're saying or experiencing like caring for someone or something, but like to the point where it's literally hurting yourself. So if
Uh
you're doing that, it's not helping anybody because like being alive is painful. There's so many awful things going on in the world. It's horrible, and we're social
mhm.
creatures that deeply pains any person who's paying attention and has their heart open. having experiencing pain and like grief about the state of the world or what other people are going through or what you're going through is not the same thing as idiot compassion, which is like
That's
righteousness and just maybe righteousness is the wrong word, but
well, to me, what I think of is like, say that doctor that's like falling apart. Like, obviously, like physical health is
yeah,
bad, yet they're still out there like just trying to treat the patients or whatever. Like, they won't put the
they're
work down
yeah for
long enough
themselves.
to see like, oh, there's a problem here
Yeah,
inside my body that needs to be worked on. Like,
yeah,
that's what comes to mind when I think
yeah,
of that.
yeah, definitely. Things
They're
will catch up with you, or they
yeah,
can catch up with you.
yeah, yeah. Because I mean, burnout, like you're
Your body's asking for something.
yeah, like it's dim or it's dark. It's gone out. Like whatever it is that makes you tick, whatever
Yeah,
your spark is.
yeah,
Um, which that's fascinating.
yeah.
We could probably just cut it out if
Probably.
needed. The
Okay, I'll.
my I don't know about my burnout and biophotons thing either, so
Okay.
that could be removed, I'm sure. But I just couldn't help it.
Mm.
I couldn't help. It's just I've been thinking about this a lot lately. Like mitochondrial DNA is also, or like our cells are packed full of that.
Yeah.
So that's also emitting light,
Mitochondrial DNA emits light.
I think.
That's what it. Yeah.
So then it's just like there's just something there.
It seems important.
It seems important, and I've just been like, I'll be driving and I'm just like mitochondria and light and like just thinking about this. Probably like there's no connection, or like I don't have connections there. I'm just, these are the concepts that are floating around.
Yeah. Well, it makes sense because, as Sandra Lee mentioned, sound is primary to light. Like sound. So sound influences light. Acoustic sound influences light. This is why sound healing works on us because we are made of light. So sound influences us. Words influence us. Affirmations
So
influence us. Music,
yeah,
comedy, sound healing.
so that sound is doing what to the light
Something.
being emitted from the DNA?
It's just something. Depends on the sound.
Yeah, it would depend on the sound for
Yeah.
sure.
But like that experiment where there's sand or whatever on a speaker
Hmm.
and then it's playing sound. So the sound is acoustic.
Yeah,
And then it's creating patterns in the sand
exactly.
because the sand is like light because everything in this universe is made of light, and so the sound alters the light. Acoustic sound alters the light.
Yeah. So that sound is primary to light.
Mm-hmm.
Does our DNA make sound? I'm not.
We make sound.
Yeah, we make sound. So like it must, or it
Yeah,
at least interacts with sound.
yeah, I wonder.
Be interesting to talk to a physicist.
Yeah, would be awesome.
Who could at least help like put that together a bit, because it's really interesting to me and there's something there.
Mm-hmm. Yeah, physics is very important.
Yeah, yeah. And that's not something we were like, there was no physics in medicine.
Very little.
Oh, what did we I guess
Like
like,
osmosis or like the Starling whatever and like lungs and stuff is like
and I guess
very kind.
ablations, like
Yeah,
using frequencies to
but
like break apart kidney stones and
it's not like light or sound is primary to light, so sound healing works. Like that was never said, but that's a pretty like basic like fundamental thing to the human body that is kind of important and that was never said
well,
because
so
it's not applied.
that's something that is like, sound healing has is central to each tradition, or like, what am I
It
trying to say?
shows up
It's,
everywhere.
yeah,
Everyone's
like
used it.
since the beginning of human stuff.
Yeah.
Like it's
They
been part of something.
yeah.
So then it would be just like colonial medicine or Western approaches to go, there's nothing here.
Yeah.
And
Even though you use ultrasound and you use these other
yeah,
forms of sound in a more convoluted fashion.
yeah.
It's just not acoustic sound. They'll use sound if you can't hear it.
So, yeah, so it's like there's something uh arrogant, I guess,
Yes.
about, or ignorant, maybe
Both.
both,
Yeah.
about just being like, this doesn't fit like my current belief system, or like this doesn't make sense
Mhm.
in it, and then dismissing it
Mhm.
because of that. And that's why I said earlier, like, biomedical models are not meant to be believed in. They're tools to
Yeah,
prove
it's
of
a tool.
something. So then it's like people trained in that are still people with beliefs, because we're humans. Belief is a big part of how we exist. So
Yeah.
then I think there's this tendency to almost go about doing Western medicine, or using the science of of empiric scientific work or whatever, to from a belief centered place. And it's like that's not what it's about. Like it's off base.
Yeah.
It's odd to me, because that is like, it goes against like the fundamentals of what scientific inquiry is.
Which is
Exploring.
yeah.
Or to me,
Yeah.
it's asking questions and then exploring to find the
Finding new
answers.
possibilities. Yeah. Yeah.
And it's like, so like, I'm interested in like arts directed research,
Mhm.
because it's like so much of like the great ideas, or like the things that have changed a scientific understanding, come to that person through an artistic or a synchronistic process
Mhm.
that's not understood,
Mhm.
but happens enough that anyone who's connected to that process knows that it's real.
Mhm.
And then from, it's almost like that, then, you know it blends into the three-dimensional world through science, or like through a new discovery or a thing.
Mhm.
But it's like it starts in art,
Mhm.
and that to me is
Or a vision or something, like
yeah,
whoever his name was that saw DNA.
yeah, like I'm calling all of that art, like,
Yeah.
because it's like that imaginative process.
Mhm.
And it's bizarre to me that people who are trying to engage in the imaginative process of science, or like, you know looking at those two things together, it's often considered less valid.
Yeah. And that's just like conditioning. That's conditioning.
Yeah, so that's kind of what I'm getting at. Like, we're creatures of belief. Like, we're humans. Like, we have, like, because if I think about me with my belief in medicine, it was almost religious in some ways, because of religious conditioning from, being a child. Like, I believe in this, I feel strongly about this, whatever.
Mhm.
I believe I can help people or heal people or this or that. That, where am I going with this?
It is there's a religious undertone to industrialized medicine. And you're not supposed to question it, and it's like this is how it is, and it's about making money.
Yeah, but it's like, it's like just the wrong place for that to be existing
Yeah, I don't
in.
know if there's a right place for that to
well
be.
well, it's just like, but it's like so misguided. It just
Yeah.
doesn't actually, like, it's boggling to me right now how that, like, it's like humans don't, if you don't realize your conditioning, if you don't realize that kind of stuff, that's what's happening. Like, because I've had a few experiences in residency. One was where, I was given a lot of autonomy. They wanted to see who I became as a doctor, and would give me some guidance here or there, or if something really went wrong, kind of jump in. And then I've had other experiences where it was like, no, we want you to be this type of doctor, very top down, like this is how it is. And it seemed like there was such a like belief aspect of how those people that were more top down were teaching and functioning and doing things. And like that's what I'm getting, like it feels like that is like that human impulse to believe in something, or like, you know, feel strongly about something, is being is happening with the within the container of conventional medicine, when all that is a tool to ground things into physical reality. It's
Mm-hmm.
nothing more than that and
Yeah.
nothing less. It's just that.
Yeah.
So it's so it's just strange to me then that how people attach all this passion and all this, like these various things to this process of using a tool.
Belief is a collective process.
Yeah.
So you need, for, yeah, belief to be grounded into physical reality, you need a lot of people to be believing it too.
Mm-hmm.
Otherwise, it doesn't get anywhere. But like internal knowing, you just need yourself.
Yeah. And I guess it feels like some of my residency experiences were trying to cultivate that internal knowing, whereas others were trying to take it away
Yeah.
so I could behave more like them
Mm-hmm.
and less like me or something.
Yeah.
So it's really, it's just interesting.
It is interesting. It's an interesting world.
And I guess like that belief thing within the container of conventional medicine, like that must have to do a lot with burnout, because someone can feel so strongly like they want to be helping or they are helping, and then that illusion can cover up what's actually happening,
Which is
which
something
is you're ordering a TSH, you're refilling someone's meds, you know, whatever, and then people just keep cycling back and forth between
mm-hmm.
these places of being like, oh, I believe so strongly in what I'm doing, then to be, or and then being like, you know, this is nothing,
Yeah,
or you know,
a paycheck or
yeah.
whatever.
And it feels, I guess, because we one of our questions was like, how do like people get disempowered? So guess that
Yeah.
has something to do with it.
Yeah. And like, the process of becoming a doctor is so disempowering. You get so disempowered and financially crippled and all these things, and then you're at the end and maybe you're disillusioned, but like you're in all this debt, so
I
you
think there's
feel the need to can just, do it anyway.
the interesting thing is there's the flip side of that. Like there's people that would find it empowering.
In what way?
Well, I mean, you're being like your knowledge or um your opinion or your whatever is being held to a certain degree because you are a doctor, because you have this.
Yeah.
So moving through that process of stepping into that could be empowering for someone.
Yeah.
But I think the
But you've got to
deeper
be disempowered before.
I think the
That's part of
deeper
training.
question is like, what is true power? Or
Yeah.
like true versus, or maybe internal versus external power,
Is
or
any
something like
power where
this.
part of it is like manipulating other people? That's not helpful for anyone.
Yeah, and there is a lot of that power in conventional medicine. Like it's, you know, you these are your patients, you know, take ownership of your patients, you know, go responsible for all these patients, like all these things we hear. um at various points in my training, they struck in different ways, sometimes more discordant than others.
Mm-hmm.
But it was always a bit confusing to me.
It was kind of confusing, jarring, shocking. Just being responsible for somebody else's health is so weird. And it's a
Yeah.
disempowering thing because if it's I'm responsible for your health, where's your responsibility?
Well, and it's that
But
kind of
like
thing.
uh,
Go ahead.
oh, I was almost there. Oh, because if you're also as a doctor or whatever, healthcare, Western medicine, industrialized medicine, you're not necessarily you don't necessarily have the tools to be giving people tools to empowering them.
Mm-hmm.
The tools that you're giving are disempowering a lot of the time. So then of
By
course you're
nature.
going to be responsible because
Yeah.
you're disempowering them.
Yeah,
So
so
then it's
you're
in
like
your
taking that
hands.
on.
Because it's like, oh, well, I've got these magic pills that'll fix this and put that way, and they might kill you, but that's why I'm responsible. And I went to school for a long time. So,
And the thing that's coming up for me right now is like that whole response to like, you know, burnout or issues in medicine or society where it's just like we just need to care more.
yeah, fuck!
And it's just like insane.
Yeah,
Like, yeah. And that's so common. It's well intentioned. It's
yes.
very well intentioned, but I don't think it's accurate to what life is or like reality.
No, no.
Because like that individual power or power, like to give power to someone would be them actually doing that stuff for themselves and then moving into a place where they don't need to do that stuff anymore.
Mm-hmm.
Yeah, unless they have some like thing that, you know, carries on with them and they have to do that.
Mm-hmm.
Um but it's just like it's interesting how this idea like that saviorism works against people becoming empowered and it creates more dependency,
Yes.
and how that is like held up as
Mm-hmm.
an important quality or
Yeah.
like you know, it just it does it's interesting, it doesn't make sense to me. It's benevolent, like it's well intentioned.
Well, maybe it's not benevolent, but
Yeah, it's well
it's
intentioned.
yeah, well intentioned. Mainly. But then there also has to be a quality to it that's like, I'm trying to prove something. I'm trying to be good enough, you know? So some of it is about, you know, how you're looking or trying to be good enough or, you know, have people think you're a good person or, you know, meet expectations or something. It's gotta be.
Yeah,
It's gotta be a part of it.
ego's got to be
Or
deeply tied.
insecurity.
Well, yeah, because that's, I mean, what we're talking about when we're talking about ego,
Yeah.
right?
Sure.
Well, it's just like
Sure,
that,
yeah.
you know, I insecure in who I am or like insecure in what I is.
Yeah. Nice. Who was I?
What is I?
Yeah.
uh, something.
I know that the best thing that I can do for the world is to take care of myself and see where that goes because we all have our own thing that we're here to do, which is essentially to be ourselves.
Mm-hmm.
It's not to extort ourselves
No,
to help people. That helps nobody.
no.
But a lot of people seem to think that bending over backwards and doing what people think they want will help them.
Mm-hmm. Well, it's a people
It's
pleasing. It's the most socially acceptable trauma response.
it is the most socially acceptable trauma response.
Like you can't just like up and punch someone when you're triggered, but you can like disappear into yourself and say whatever they need to hear
Or
to make
bake them
them feel
cookies or
better. Yeah,
something.
you know, show up and shovel the driveway.
Yeah.
You know, these we're talking about acts of kindness here as if they're bad things.
They're not bad
But
things, but like if you're doing things like that all the time to make people like you, you're going to get sick.
yeah, yeah, it will exhaust the person.
Because it's unaligned and it's not authentic. Because we have the energy to be authentic. We have the energy to do the things that we're here to do, not
Hmm.
other things.
Yeah,
And that's, I guess, where disease happens. That's part of it.
yeah,
There's more to it than that, but that's part of it.
yeah. It's an important sentiment. It's like contributing factor at the very least.
Yeah. Are you doing things you don't want to do?
Yeah.
If that was on, yeah,
Well, like,
risk factors.
well, and just
But it
like
is. It is a
ask,
risk factor for like everything, I'm sure.
but it's just like asking people, how do you feel about yourself? Like, I remember when I started doing that from time to time, it was like, you know, people would look at me like I'm grew horns or something.
What kind of question is that?
Yeah. Like it was so, but it's like to me that was the important question to be asking in that situation.
Mm-hmm.
Not if their hair is falling out.
Yeah.
uh, yeah, so there's like a level of ignorance and saviorism that says like, just do more.
Yeah, just do more.
Um, that is well intentioned but misguided.
Mm-hmm.
And my experience with that type of situation was that it was very top down. It was very, you are who we tell you to be. Like it
Mm-hmm.
was very that kind of energy. Um, versus, you are a whole person that will make mistakes but also do good things, and we just want to see who you become kind of thing.
Yeah.
And it felt like those were two different models I experienced in residency, and they're very different things,
Yeah.
come from very different places.
Yeah.
Yeah, because you mentioned rotten roots earlier,
Mm-hmm.
so this would be those, like that exploitation and saviorism and ignorance.
Yeah. Yeah. Safe medicine.
Yeah,
SAIF.
saviorism, arrogance, ignorance, and fear.
Yes. TM. Just kidding.
uh,
But these are
I mean, they're things
what's
that
going
need to
on.
be talked about and looked
Yeah.
at the least.
Mm-hmm.
Um, yeah,
Mm-hmm.
because I mean, those qualities are what give birth to colonization, to exploitation, to whatever phobia
Mm-hmm.
or thing we want to, whatever oppression the system is
Yeah.
putting out.
Literally, that is what would have given rise to colonization, like saviorism, arrogance,
Mm-hmm.
ignorance, and fear.
Mm-hmm.
Yeah,
Yeah, these people need
that's
Jesus.
yeah,
They don't know what they're talking about.
yeah.
They're crazy. Yeah, like that 100% is the force behind it. And that is what has created the medicine that we are trained in.
Mm-hmm.
And that's why I'm saying it's just a tool.
Yeah,
Like it's nothing more than that. It's nothing less than that. It's just a tool,
yeah,
and we don't need to attach story. We don't need to attach stuff to it because that just perpetuates something.
yeah,
Like it's more about what other tools can
yeah,
we be using.
yeah. Because it's a good tool for some things, like
Absolutely.
like broken arms that need pins.
Yeah, and I mean it will help with someone's symptoms.
Yeah.
It will help with things, and it needs to be used at certain
Mm-hmm.
points, but it's not something to be like held up or believed in or anything. It's just
It's a tool.
a tool that should be used with a lot of discernment.
Yes. Mm-hmm. That's the takeaway.
That's the takeaway. Yeah.
Okay, so we'll each share a poem. Do you want to go first or second?
Um, I can go first,
Sure.
or you go first.
Sure. If someone calls you a hero, someone else will call you a villain when we're all just tired people doing our best with what we're given.
Excellent. Um, this one is a little bit wordy, but bear with it.
That's good.
I called it Lifting the Anathema of the Anthropocene. It burns bitterly inside of our marrow, its potent rancidity paralyzing us in fear of the morrow. We're trying to open to our emotional egregore, like Rumi in his guest house, welcoming in novel lore. Of our existence, our truth in this place, trying to not falter as smoke curtails the rat race. As culpable as we feel, it wasn't our fault. We inherited exploitation, acerbic assault. Conditioned we entered, deconditioned we will leave, if we trust the saving beauty our intersecting lives weave. Disillusioned walks by the river's rolling edge, letting our tears fall, lifting the heaviest of lead. From our chests, from our bones, it no longer caves us in. We dispel disenchantment. The age of cosmopoiesis is in.
There's a maple on your pants.
Cool. I don't know. I'll just let him continue to crawl. Well, I don't know. It feels rude to flick them off, but
Yeah.
I guess whatever.
We'll do what you
find
want.
its
They're
way.
not poisonous.
Yeah, like it'll find its way.
Yeah.
I saw an owl last night.
Really?
Yeah, it was like sitting on the telephone pole, like at the farm, just hooting. And so I went over there to look at it, and then the dog started barking at it, and it like flew right over.
Oh, that's awesome.
And
I've
it
never
was-
seen an owl.
Thanks for listening.
See you again next week.
And then I went and checked out your Patreon, and there was one conversation.
Yeah, but a new one every month.
Yeah. We should use that.
Yeah.
If you want to further support our podcast, go check out our Patreon.
We got content on there now.
Before we didn't.
But now we do.
It's evolving.
Yeah. Just like humanity.
That's good.